Although cats are fairly easy to care for, there are a lot of things they should have. In this video, I'd like to talk about our recommendations concerning these 5 aspects of cat care. We recommend a physical examination on cats every 6 to 12 months. Although domestic cats are social animals, they are descended from solitary animals, and because of this they are very good at hiding diseases, at hiding pain and suffering. So we do find a lot of things during routine physical examinations that come as a complete surprise to the people who live with the cats. These photos are examples of a few of the diseases that we might find in cats who seem to be doing well at home. Addressing these things can make a big difference in keeping the cat happy and healthy, and it really is worthwhile to look for them. A blood panel and urinalysis can also be helpful, especially after cats enter middle age. Even the best physical examination will miss some things that laboratory testing will find. The second thing on our list is infectious disease control. There are 2 important retroviruses that cats can carry without showing any signs for months to years: feline leukemia virus and feline immunodeficiency virus. We don't currently have proven effective treatment for either of these viruses, but it is valuable to know if a given cat is infected, for the sake of the cat, for the sake of other cats, and for the sake of humans. So, we recommend testing all cats for both viruses when they are first brought into a household, and then periodically depending on specific circumstances. Also important in controlling infectious diseases are vaccinations. There are 3 vaccines that we give: rabies virus, feline leukemia virus, and FVRCP, also called distemper upper respiratory or 3-in-1. Some rabies virus vaccines, some feline leukemia virus vaccines are associated with causing cancer at the injection site. It is uncommon, less than 1 in 2,000, with some brands of vaccines more likely to cause it than others. We do use vaccines that were designed to specifically not cause cancer, but because of this and other potential short and long-term risks of vaccinations in cats, we try to give only what is needed. We recommend all 3 vaccines for kittens and all 3 vaccines for adult cats exposed to unknown cats. So kittens and outdoor cats get all 3 vaccinations. We recommend against the feline leukemia virus vaccine in indoor cats who have no exposure to unknown cats. So if all the cats in a household have tested negative for feline leukemia virus and they only have exposure to each other, we recommend giving these indoor cats only the FVRCP vaccine and the rabies virus vaccine. The feline leukemia virus vaccines and rabies virus vaccines are given on a set schedule. The FVRCP vaccine is given on a set schedule to kittens, and then to adult cats it is either continued on a set schedule or given as determined to be needed by vaccine titer testing. In adult cats, we can test the blood for antibodies for the viruses in the vaccine. The idea is that if a cat has sufficient antibodies, they don't need the vaccine. Okay, let's talk about parasites, both external on the cat and internal in the cat. Cats can carry external and internal parasites that can affect the cat's health and the health of humans and of other pets, so we recommend testing every 6 to 12 months for parasites and giving monthly treatments at home to prevent parasites. This is especially important if the cat is living with any humans who are at increased risk from parasites. This includes young children, pregnant women, and anyone with a weakened immune system. We check for external parasites when we do the physical exam, and this is also something that you can do at home. And we check for internal parasites with a laboratory test that is run on the cat's feces, their stool. We generally ask clients to bring in a sample of their cat's stool when they come in for the physical exam. This sample should be as fresh as possible. And it's fine, by the way, if there's cat litter on the sample. But it is better to prevent some of these parasites rather than just treating them when we find them. So we also recommend treating cats monthly to prevent fleas and to prevent internal parasites. In this area, we see a lot of indoor cats who manage at one time or another to get fleas, and those fleas can carry organisms such as Bartonella that can cause serious disease in people. So it really is safest to treat all cats to prevent fleas as well as the internal parasites. Next on our list is providing means of identification if lost. We recommend that all cats wear a breakaway collar with a phone number on it and that all cats have a microchip. Even if your cat is indoors only and runs to hide under the bed at the first sign of danger, we recommend keeping identification in and on them. With an earthquake, wildfire, or burglar, your cat may suddenly run for the outdoors and you'll have the best chance of finding them if they have both a collar and a microchip. The collar is so that anyone finding your cat will immediately know that they have a home and will be able to call you without delay. The microchip is critical if that collar comes off. final thing that I'm going to talk about is nutrition. In some respects, it really doesn't belong on this list because it has more to do with what is going on at home than what is going on here at the veterinary hospital. But it is just so important to your cat's health that I can't help but mention it. Cat nutrition is a controversial subject, but our take is that cats are carnivores. They did not evolve eating corn or sweet potatoes or blueberries or other foods high in carbohydrates. They evolved eating other animals, and we really think that the scientific evidence supports feeding cats foods that are high in animal-based proteins and low in carbohydrates. In other words, canned food that contains animals and vitamins and minerals. We recommend feeding no more than 5 or 6 pieces of dry food per day. And since dry food may contribute to the tooth resorption that we see in cats, even those 5 or 6 pieces may be too much. Thanks for watching.